Welcome to the Dynamic Physical Therapist. I'm your host, Jason Engelett, and I'm here with Dynamic Physical Therapy founder and physical therapist, Michelle Sierra. Hey, Michelle, great to be with you.
Thank you.
So what are some of the conditions that people usually have coming in looking for therapy?
Some of the most common conditions that we treat are related to the spine, because that's the most common condition that affects the American population. But we also treat things like bursitis, tendonitis. We can treat pregnancy-related low back problems. We treat conditions such as stroke, neurological conditions, conditions related to deconditioning. We have some patients maybe have had multiple surgeries this year, older patients that might find themselves having difficulty to get out of bed and do their various functional activities. We treat conditions related to the knee, hip, foot, and ankle. Plenty of shoulder problems, whether it's a rotator cuff condition, pre-surgical and post-surgical. A lot of our patients will come to us to try and avoid surgery by coming in restoring muscle strength and range of motion. We're able to prevent some of that. So a lot of times we're able to treat them pre-surgically, and then of course after surgery. We treat many ACL repairs, rotator cuff repairs, disc herniations where they've gone in and removed that herniated disc portion. We're able to get those people back to function.
Well, you said before surgery, so you can actually avoid surgery through physical therapy. And what about, I heard that medication, maybe I can avoid medication through physical therapy. How's that?
Right. Well, a lot of times patients come in and they don't want to take pain medication, or the doctors are sending them to therapy in attempts to avoid the more invasive surgeries. What we do is we use pain-relieving modalities to try and calm down the inflammatory process. We're trying to decrease muscle spasm, and just a result of those things and teaching people proper body mechanics and how to move and do things properly, we're able to decrease pain without the use of medications. Many times we're able to help. Say you have a shoulder impingement problem. If that were to go untreated as a result of muscle imbalances, you may be looking at a rotator cuff repair down the road. So we encourage patients not to ignore their pain and just live with it. Go get treatment, come to us, we'll restore some of those muscle imbalances by restoring range of motion and strength, and many times be able to avoid the more painful and invasive surgical procedures.